Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. The coronavirus pandemic has accelerated the adoption of telehealth services. Joining me to discuss is Sebastian SeigueR, CEO of Emoka. Sebastian, welcome to Trade Talks.
Thank you very much for having me.
What trends were in place prior to COVID-19, and why are consumers of healthcare increasingly turning to telehealth services?
So in general, over a long period of time, you did have telehealth starting to make its way into the market, but it was a very slow roll. The regulatory bodies in the United States, particularly CMS, started relaxing regulations and also allowing reimbursement models for telehealth that previously hadn't, but it was a very, very slow process, and COVID-19 did speed that up dramatically.
Where does Emoka fit into the telehealth ecosystem?
We're a version of telehealth. I guess you could really call it asynchronous telehealth or asynchronous video that I think is going to find its place once live video becomes rote and let's say a commodity. So we're a way for patients to communicate with their providers through video messaging as opposed to having to have a live connection.
So how is Emoka differentiated from other telehealth services that are out there?
Think about it this way. Live telehealth allows a provider, so a doctor or a nurse, to see a patient in real time, but they're at different geographical locations, obviously, right? Emoka is asynchronous, so not only are the patient and the provider at different places, but they can have their appointment at different times. And Emoka is really geared towards the time in between visits. So live telehealth will replace some in-person appointments. Emoka is the time in between those appointments, whether they're live, whether they're on video, and it helps patients take every dose of their medication every day.
What's your outlook for telehealth for the remainder of 2020? And do you expect the demand for digital health services to continue post COVID-19? It seems to be whether a company is part of fintech or EDU tech or any of the other sectors that are increasingly becoming digitized, there's at least the expectation of a hybrid relationship going forward.
Absolutely. I mean, there's no way that not seeing the doctor in person is going to ever go away. But there are things that consumers demand in terms of convenience. So we're used to, texting. We're used to using social media, phone calls. All those tools have not been available in the past for healthcare, and now consumers will demand them because they're used to them. So you're used to now having a video call with your doctor. You're going to want that after the pandemic as well. But really a prerequisite will be that that certain relaxation of regulations that have been put in place for the public health emergency last beyond the public health emergency, and that's not clear just yet.
All right, Sebastian, thanks so much for joining us on Trade Talks.
Thank you so much for having me.
And thanks
Take
for
care.
joining me. I'm Jill Malandrino, global markets reporter at Nasdaq.